I mean, how does the influencer or clinic that you go to make money if you are taking 0 supplements for your hair?
Yeah, and actually, I think I get everything we've talked about so far from Mark Cuban's Cost Plus Pharmacy.
Costplusdrugs.com, you can look it up. Yeah, every single thing is on there.
Yeah. And now, I guess we can chat about my hair loss stack.
Mm-hmm. So, yeah, I guess, how do you see things differently between your fertility phases and your non-fertility phases? And what do you start with? And when do you add it in? And when do you take it out? And what are all,
Well, that's a way that my regimen is even simpler because I am not concerned about fertility whatsoever right now. Fertility, I had to look up what that was when we were planning for this podcast, actually. But all jokes aside, in my DHT or androgen pool, I do like to maintain a higher normal level of testosterone. Mm-hmm. I have a longer than average CAG repeat, so in theory I should be less sensitive to testosterone. So that's something that I do think of in the context of long-term neurological health, cognitive health, mm-hmm. And then also just things like body composition and energy levels, some of those things that people feel to varying degrees. But I use Dutasteride 0.5 milligrams daily.
Wow.
I've not always taken that dose of Dutasteride. I started very slowly. And that actually was after trying finasteride.
I'll pretend to be very surprised. So you're saying that you'd like to have a higher than normal testosterone, but when you want to have a higher than normal DHT, especially if you're like not hypersensitive to androgens.
Nope, not concerned about it. I trump the, I guess, theoretical need for DHT because I don't think that there's a proven need for DHT other than during sexual development, during in utero. Like, those are times when I think you would specifically not want to block conversion to DHT. But for the average adult male who's, let's say, post-25, because that was actually myself, I really wasn't doing anything. I may have done some Rogaine on and off prior to age 25. I actually started balding pretty aggressively around age 22. So very early onset. It seems to run in the family history. And today, fortunately, I do have more hair than I did back then. Mm-hmm. So that's a good thing. But when I started finasteride, I didn't seem to react particularly well to it. I was pretty well versed in this space, but hey, I'm 25 years old. I've been reading about these things, and I actually started with the 1/4 milligram dose. I wasn't taking a whole milligram. I'd seen the charts, and I was like, I don't really need this much. And I still did not seem to tolerate it particularly well. I was still having just this one single side effect where I would sort of compulsively check my alarm clock that I was setting for the next day each night. And I was like, well, this seems a little bit like OCD, and I don't want to reinforce this pattern. So I dropped it for a time period, tried topical Dutasteride, actually. That didn't seem to be particularly effective in my case. I did use it consistently for about 6 months. And then we fast forward to today, and my stack is 0.5 milligram of Dutasteride daily, 1 milligram finasteride daily, and I use a 2% prescription Ketoconazole shampoo about twice per week. I think it's about every 4 days is what I average there.
So how are you using more finasteride now? You'd think you'd have 4 times the side effect if you're on 4 times the dose.
Yeah, and for a while, I was not on finasteride. This was probably, something like 6 months ago, I think I added it in. And I had been on Dutasteride for probably 1.5 years, maybe close to 2 years at that time. So I was interested in the sort of the theory of the different pools, the different 3 subtypes of 5-alpha reductase, and looking at how Dutasteride and finasteride sort of almost fit together like Tetris. If you're looking at which enzymes are inhibited, I had a hypothesis that I would add in the finasteride while on Dutasteride and not have a resurgence of that. And then, for whatever reason, whether it's my theory being proven correct or whether it's just a placebo positive effect, I've been able to add that in, tolerate it, not have any adverse side effects as far as I know. I'm sure that sperm counts are down slightly, but that's not something that I have measured at this point.
Yeah, it is something that I have measured, not to skip back to my area or whatnot. But yeah, dutasteride certainly affects that. Yeah, as far as the, I guess, even inhibition of the isoenzymes, I've certainly heard from patients that are on finasteride plus dutasteride, and even some that are on finasteride plus palmetto, that they tend to have less finasteride side effects, with the caveat that if you have lower total androgens, it is very common to see more side effects that are hypogonadal, but none of the finasteride syndrome side effects, if you will.
Yeah, thinking about where these different isoenzymes are active. And we've done a whole podcast on this. Fortunately for myself, I didn't have any sort of finasteride side effects.
Yep.
But we do know that finasteride tends to deplete the pregnenolone pool a little bit more than dutasteride is. And it's sort of a slow, steady drop-off. So it's not something that happened day one, the first time I took a pill of finasteride. It was something I noticed probably about 2 months in, I would say.
Yep.
And I started noticing, this is kind of odd.
Yeah. Did you do anything specific to remove other potential confounding variables? For example, a lot of people who are on finasteride or dutasteride, if they have any side effect whatsoever or any change in how they feel, they just kind of assume that it's due to those. Surely it couldn't be related to, blood flow because I've been exercising less, or surely it's not due to stress or social situation or an episode of prostatitis. It's pretty frequent to see people who have had those side effects in the past that turn out, in hindsight, to be something else.
Yeah, it's certainly possible. I mean, I would say that at the time, life in general was relatively high stress. I mean, it's all relative compared to what your baseline is and what other life experience you have. But, in that time frame in my life, working, in, I believe, a couple of different capacities, managing multiple roles, it probably was a slightly higher than average stress time period. But it was a pretty easy sort of initiation and then withdrawal, and then starting back at even a less frequent dose and seeing those same sort of things emerge. So could it have all been placebo? Possibly. But I guess my theory at this point in time is that with the way that there's relatively equal inhibition of the enzymes, that now that's why I am able to take both dutasteride and a higher dose of finasteride. I don't really see myself experimenting with just finasteride solo. It just doesn't fit my cosmetic or aesthetic goals.
Yeah, I would agree that it seems like just the risk-benefit analysis, again, that scale and that balance, finasteride solo for a lot of people that have not been on that same dose and tolerated it very well for many years. For people who are changing dose or initiating, often not the ideal candidate. So I guess you haven't talked about Ketoconazole yet. This is when you can plug the Derek's product from Intelligent, right?
I have never used that product, actually. I hear it's good stuff. It's a little bit drying, a little bit volumizing. I get the same effect from the prescription Ketoconazole, which is why I don't use it every single day. I probably use it every 3 or 4 days on average, something like that. But I like using a slightly higher percent. I guess I could apply double the volume of the Intelligent shampoo and get the same milligram or microgram amount of Ketoconazole on my scalp. That's a lot of shampoo.
I mean, how does the influencer or clinic that you go to make money if you are taking 0 supplements for your hair?
Yeah, and actually, I think I get everything we've talked about so far from Mark Cuban's Cost Plus Pharmacy.
Costplusdrugs.com, you can look it up. Yeah, every single thing is on there.
Yeah.
But if you come to our clinic, you do have to use our proprietary compounding pharmacies for everything, where you pay the clinic and then we pay them.
Yeah, except not for us.
That's a joke. Yeah. Actually not. Even if you come to our clinic, for everything possible, we also use pharmacies like Cost Plus Drugs.
Yeah, we often do because a lot of commercial pharmacies are ripping people off on Dutasteride or Ketoconazole.
All right. Well, this is pretty boring so far. Dutasteride, finasteride, Ketoconazole. For growth agonists, can you at least talk about some peptides or something like that? That, the more research that needs to be done, the stronger it is, right?
Yeah, good old minoxidil. So like I mentioned, I used the topical, 5% Walmart brand or Kirkland brand, and it was actually quite effective in my case. And I used that fairly religiously. I would use it at least 6 nights a week. I've been inconsistent with microneedling over time. We'll talk a little bit about that. But I specifically wouldn't use it after microneedling. And then at some point I was like, well, let's try, oral minoxidil. This was probably 6 months or so before that New York Times article came out, where now it seems like every dermatologist is putting people on oral minoxidil.
I assume you got the $300 Fagron test to tell you if you're a SALT 1A1 heterozygote or homozygote.
I did
See
not.
if you're a responder?
Yeah, I did a in vivo test and saw that I was, in fact, a responder. So then my decision to switch over to oral minoxidil was more out of convenience and not for a lack of response. And I've given some thought to trying both vectors or potentially moving back to a topical. But as of right now, I've slowly worked up to 5 milligrams per day. I've seen as high as 10 milligrams prescribed, but that tends to come with hypertrichosis, which I already have without any minoxidil, even on Dutasteride and finasteride. And then also I see some fluid retention that could come along with that. You always have the risk of a hypotension that can occur. Very small risks, but things where I feel like it's probably not worth doubling the dose from 5 to 10, whereas I thought, going from 2.5 to 5 was pretty reasonable. And I actually start at a half of a tablet, which is a 1.25 milligrams. Very rarely, never would I put someone on like 2 milligrams, 2.5 or 5 milligrams to start. So I slowly titrated up. And something a little bit unique I did here was I kept using the topical for about a month while I was introducing the oral minoxidil. And I did not have a shedding phase, which I was fairly well prepared for. It's quite common when either beginning or discontinuing topical minoxidil or oral minoxidil for that measure to have a shedding phase. So I was fully prepared for that and pleasantly surprised that it did not occur.
Yeah. On that note, of course, minoxidil is a prodrug. Minoxidil sulfate, at least as far as we know, is the most pharmacodynamically active compound. And there's a lot of minoxidil converted to minoxidil sulfate in the liver. So oral generally has great efficacy. You can see our other multiplier last podcast for more discussion into that. I did very briefly use minoxidil once. I don't know if I told you about that.
You did it once.
Well, I think it was like 4 times. But I decided to grow in these little patchy areas of my beard. So I was going to microneedle and actually use castor oil, prostaglandin, and some Minox topical. And yeah, that lasted like a week or a week and a half. And then have
beard
not had
growth protocol.
Yeah, maybe in the future. But as far as like my beard, I think it improved just a little bit while I was on Dutasteride. But generally when I'm on Dutasteride, I'm on something like 15 mgs of Test-Zip per day. And generally while I'm off, when I get all of my unwanted chest and abdomen and back hair, which is not terrible, I can't complain too much as far as like the genetic predisposition. But I know I get all of that when I'm on my fertility phase, when I'm off my Dutasteride, when I'm just on something like just HCG and FSH. I tend to get a lot of unwanted body hair.
I guess moving on to my other category, I have started with consistent scalp PRP. I guess something I would put under the failed interventions bucket was scalp neurotoxin. So there's been some studies done with botulinum toxin, Botox specifically. I tried the Xeomin that we administer here in the clinic. I did 2 rounds about 3 months apart of 100 units into the scalp. I did not see a measurable change there. Certainly nothing close to the scale you would see in a responder in the studies. So I decided that the juice wasn't worth the squeeze there. And I've since paused putting Xeomin in my scalp, and I have started putting Xeomin in my face. Maybe that's a topic for another day. But I've started with consistent scalp PRP injections, so I'm expecting once I get around to 3 or so of those, I'll probably do 3 of them about 4 or 6 weeks apart, and then at 6 months kind of gauge what the effects look like there. And then I have started microneedling consistently. Here's the plug. Thanks to the Intelligent Shop microneedling pen.
Nice. Yeah,
I like
funny.
it a lot better than what I was using prior. What I was using previously had a lot of wires and cords, and it was bulky, and the cartridges didn't like to stay in the microneedling, so it was a real pain. And that's why I was inconsistent with it, because then the cartridge would shoot off, and then it would break, and then you'd have to order more from Europe, and that takes time. But now with the Intelligent Shop pen, I've been able to do that consistently for a few weeks now. So I plan to continue doing that, because there's basically no scenario in which it's not going to be beneficial. I'm going up to somewhere between 1 and 1.5 millimeter depth. You can get erythema or redness quite easily. You could get that from 0.5 millimeter. But I'm trying to target just pinpoint bleeding. So that that's another metric of treatment target or efficacy that they use in the microneedling trials. So that's my protocol. I tend to tolerate about once a week just fine. I'll probably skip 1 week a month if I have like a haircut scheduled the next day or something like that. Something in my schedule where I don't want a very red, irritated, flaky scalp. So I'm probably doing it about 3 times per month. And then I guess under blood flow, exercise, that's a given. And then I do take tadalafil 5 milligrams a few times per week. I have yet to have any kind of prostate issues or nighttime urination. I will frequently drink a whole glass of water right before I go to bed.
It's impressive.
I think that's probably due to the Dutasteride, though. And the fact that my kidneys know when to settle down and not make urine. So we'll see how long I can keep that up. But
wait another 5 years till you're as old as me.
So I like the tadalafil. I don't like taking it consistently, because I feel like for me it does build up a little bit. I have a little bit of flushing that may come along with that, and then erections when they're not supposed to happen can be bothersome. So using a lower dose or less frequency, that seems to be a good mix. And then when you are taking it, you're getting a slightly potentiated effect compared to if you were taking it 7 days a week. And again, that's my experience. I've heard this is sort of variable from person to person.
One thing to watch if you're on both tadalafil and minoxidil, not in your case, but if you do have some POTS tendency, some tendency for orthostasis or low blood pressure or high heart rate when you stand up, then both can drop your blood pressure just a little bit. I tend to not take tadalafil right before my deadlift days.
Yeah, that's a great tip. A lot of people are now taking tadalafil pre-workout.
Watch for back bumps.
Substitute for their nitric oxide booster. I think there's even a company out there that calls it the first prescription workout medication. Which is interesting marketing. But yeah, definitely don't want to do it when you're going to be likely to pass out.
Or doing anything that could give you back pumps. It's
a no-go.
It's not great for me. I guess one other thing we could note, if somebody does ask about zeomin or botulinum toxin response, in general, you'd think much thicker scalp and really a lot of tension. Perhaps they have tension headaches all the time. Their temporalis is always tight. Some people are still good candidates. But Maddie always tells me I have a really thick skull, but I don't think I have a thick scalp.
So the thick skull has caused the scalp to be thinner.
That's I guess
directionally how that would work.
It's like more the filling of the Oreo, but less of the outside.
I don't tend to be a particularly stressed person, so I don't tend to carry a lot of muscle tension. I don't think that I have a lot of tension in my scalp, or I would say my scalp skin is slightly thicker than average. But again, it's not something where I feel like it is substantially thicker and needs to be relaxed in that manner. And some people will report less sweating with zeomin or with any kind of Botox injection. I'll say that I didn't necessarily note that. Again, I didn't measure the volume of sweat output, but occasionally I will go work out and finish a workout with some hard cardio, wearing a hat. and the hat was quite heavy regardless of whether I had Xeomin in my system or not.
Mhm. It's a nice little scientific way to measure that.
I should have weighed the hat in post-workout.
It's like the opposite of a shower drain hair catch, which is also not perfect or ideal. But I guess on that note, any tips for pain control when you microneedle? Because the scalp can be a very sensitive area, especially around those temporalis muscles.
Not really. I feel like maybe the area gets a little bit desensitized if you go over it at like a quarter millimeter first.
Mm-hmm.
You're just doing a little bit to kind of warm up the area. But as far as numbing, I've tried lidocaine creams, I've tried lidocaine injections. You really cannot numb the scalp well, or at least I'm not particularly good at numbing the scalp. I know I am a responder to lidocaine. I've had some skin lesions removed, precancerous, those sorts of things. I can say that because now I have life insurance. And the lidocaine was very effective. I did not feel those biopsies or the stitches. And then with lidocaine injections directly into the temporal areas, I still felt the microneedling. It was perhaps about a quarter less intense, but really not worth the time, preparation, and waiting for the lidocaine to kick in.
Yep.
So basically, you just have to deal with the pain.
How about those little vibration creators they use a lot in, like pediatric urgent cares and whatnot? That could be worth a try for some people.
It may be interesting to try to sort of distract or give another sensory input. I also tried ice packs, and that doesn't seem to do anything either.
Yeah, so your results can vary, but in general, the thicker the skin, for example, skin on the scalp, very thick. The topical lidocaine creams like Imla and whatnot, they're just not going to do as good at penetrating through. But it is tolerable, and it can be done outpatient if your healthcare provider, for example, us, if you're going to be in Kansas City, kind of shows you what it's like, and they show you how to microneedle, although it's not particularly difficult. Yeah. Sometimes people feel best getting one done first in their local doctor's office.
Yeah, I haven't tried conscious sedation or anesthesia. That would probably give you substantially less pain.
Ketamine-assisted therapy that distracts you.
I do my talk therapy and
therapy.
Get my microneedling at the same time.
Yes. For the right patient, that theoretically could work, wildly enough.